So today's topic is opium. What do you mean by opium? শুনেছিস কোনদিন? বসে বল। আফিম। আফিম কি? আফিম হচ্ছে নেশার জিনিস, ঠিক আছে? ইটস এ নার্কোটিক, ইনফেমাস নার্কোটিক। So have you seen this? Can you identify this city? The iconic boat, iconic tower. This is a picture of Hong Kong. Now, what has Hong Kong got to do with this opium? You see, in the 19th century, এটা বন্ধ করে দাও, এটা বন্ধ করে দাও। হ্যাঁ, ঠিক আছে। In the 19th century, the British used to import lot of things from China. The Chinese demanded silver as payment. So, but British did not have anything to sell to China. They were buying from China and buying from China, creating this trade imbalance. All the silver went to China. So the Britishers came up with this crooked idea. They started to cultivate opium in India and export it to China. So as you know, opium is a narcotic, okay, নেশার জিনিস. So the Chinese government cracked down on sale of opium. That led to this opium war between the Britishers and the Chinese. So the Chinese lost the war and had to give this Hong Kong to Britishers as a gift. So it is still well documented that the power of narcotic, the opium. Okay. So where is opium derived from? Opium is derived from a plant source. কি বল? না, Papaver somniferum, ঠিক আছে? It's a poppy seed. Poppy মানে পোস্ত, ঠিক আছে? So these are poppy plants. These are poppy pods. এখানে বর্ধমানেও প্রচুর পোস্ত হয়, ইলিগালি হয় কিন্তু হয়, ঠিক আছে? বর্ধমান, বীরভূম। So these are poppy pods. When they ripe, you give this incision on the poppy pod. This resin comes out, white color resin. So these resins are used for manufacturing of opioid. Okay, opium, derivative of this resin. So before we come to opium, let's refresh our memory about the pain pathway, which is taught in physiology. So there are two type of fibers, C fibers and A delta fibers. One carry fast pain, another slow pain. Okay. So there is obviously some receptor through which this pain moves. At the dorsal horn, they make a synaptic connection. Then the neuron crossovers and ascends upward. So this is the pain pathway. So in the dorsal horn, beside this neuron, there are plenty of interneurons. Okay, in the substantia gelatinosa, in this region. So what happens when this pain becomes unbearable? There is certain pathway from the brain comes down. ঠিক আছে? These are the descending fibers. So they discharge in this region, in the posterior horn. due to their discharge, the pain is not being able to be transmitted out here in the synapses. So, this is the gate for transmission of pain. So, anything that can control this can control the pain. Okay. So, this is the gate pathway. পড়েছিস তো তমলুকের ছেলেরা পড়াশোনা খুব ভালো হয়, প্রচুর পড়াশোনা করে। So, here is a amplified picture of substantia gelatinosa. So, these are interneuron. So, when these C fibers and A delta fiber they also discharge in the substantia gelatinosa. When they get excited, they release certain neurotransmitters, certain chemical substances. They prevent the transmission of pain from this fiber into the next neuron. So, this is basically the synapses. These are discharging some chemical substances and that is stopping release of chemical substances from the fibers. Okay. So, this is a control by the C fibers and A delta fibers. So, something other is it C fiber and the A delta fibers. Okay. They themselves have a control mechanism, and also from the above there is a descending pathway from the brain to control the pain. So, another picture. So, suppose there is a pinprick in your hand. Okay. So, in the first they go to the ganglion and then to the posterior horn. So, there are two type of sensation are being activated. One is the touch. It does not cross over, it goes on like that, and another is the pain that crossovers and goes on like that. Now, this region is both touch and the pain travels through this region. Now, what happens when the touch fiber gets activated? It can suppress the pain fiber, the transmission of pain fiber. Sometimes when babies falls, they simply rub their hand, balai shat. So that basically the phenomena is the touch fibers are activated and they prevent the pain fibers. They prevent the transmission of pain by the pain fiber. So that is another mechanism of control of pain. So this is the gateway of transmission of pain. Okay. So, the first opioid that was isolated was morphine. Okay. Morphine is named after the Greek god Morpheus. So, Morpheus is the god of dreams, স্বপ্নের দেবতা, ঠিক আছে? So, after which morphine is being named. So, our discussion today will be regarding morphine, mostly centered around morphine. It is a prototype drug, first drug to be isolated. So, we will center our discussion around morphine. The other are codeine, theanine, papaverine, noscapine. Okay. So, in the structure you can see this is the basic structure. Okay, morphine, codeine, theanine, these are the similar structure, and papaverine and noscapine have somewhat different type of structure. So, another thing, opioids and সব জায়গায় পেয়ে যাবে, ঠিক আছে? এটা দেখানোর জন্য দিচ্ছি, এটা কোনোদিন কেউ তোকে বলবে না ইটস টু হার্ড ফর your level, ঠিক আছে? So, another thing is opioids and opiates, ঠিক আছে? Opiates are derivative of natural opium, derivative from the poppy plant, the pods of the poppy plant. And opioids are any substance that produce opium-like action. Okay, they may not be structurally alike to the morphine or codeine, but they have similar structure, similar function like that of opium. ঠিক আছে? So what are the use? তারপর নেশার কথা তো হলো, এবারে what are use? কিসের জন্য ইউজ করা যেতে পারে? পেইন, ঠিক আছে? So then come to the receptor. Next day we will have a detailed class on the receptor. Mu receptor present in periaqueductal grade, nucleus tractus solitarius. Nucleus tractus solitarius is related to pain, related to fifth nerve. ঠিক আছে, ঠিক আছে? Area postima. What is the function of area postima? This is a circumventricular part of the brain. ঠিক আছে? The vomiting centers are located in area postima. ঠিক আছে? Dorsal horn in the spinal cord. Then Kappa, cerebral cortex, striatum, hippocampus. Hippocampus related to memory, limbic system. Okay. Dorsal horn, medulla, delta. Delta হচ্ছে trigeminal nucleus, mesenteric plexus. So there are some endogenous opioids. Endogenous opioids means the opioids that are produced by the body naturally. There is massive amount of pain which the body cannot tolerate. So the body tries to accommodate that pain. Pain is a useful reflex. Okay, if you get a pinprick, suppose you are walking and you get a pinprick on your foot, the pain reflex, you immediately withdraw your foot. So pain is a useful reflex. Okay, so mu receptor, so agonist is endorphin, kappa dynorphin, delta enkephalin, NOP nociceptin. Okay, so first use is pain. আচ্ছা, কেটে গেলেও তো পেইন হবে, তার জন্য কি ওপিয়াম দেব? Opium is a very strong analgesic. ঠিক আছে? So what type of pain would we address by opium? So it is poorly localized dull visceral pain. ঠিক আছে? So pain, if you get a cut injury, there will be inflammation, there will be release of inflammatory mediators. তাহলে কি ইউজ করলে ভালো হবে? So some anti-inflammatory drug will be useful for that. ঠিক আছে? Then there is neuropathic pain, certain irritation of nerve get compressed, maybe some enlargement of bone in the spinal cord or carpal tunnel. Okay, so what kind of analgesic will be useful? So pregabalin, anticonvulsant, these will be useful for neuropathic pain. This opium is useful in poorly localized dull visceral pain, like myocardial infarction. Okay, pain in the chest, poorly localized dull pain. ঠিক আছে? আচ্ছা, gating of pain impulse. So just now we have discussed how gating can alter the pain impulse. Spinal action. So the receptors are present in the spines, in the dorsal horn of the spine. So they can modulate the pain. Supraspinal action. So the pain goes to the brain. Okay. Pain goes to the brain where sensation of pain takes place. So opium can also alter the sensation of pain. ঠিক আছে? And local action. Local action means the action at the level of receptor. That the receptor may also be altered by these opioids. So, it can alter at the receptor level, it can alter at the dorsal horn, it can also alter the sensation, and also it can stimulate the descending pathway that controls the pain. So, once again, so you see these are rising of the pain fiber. Here in periaqueductal grey matter starts the descending fibers. Okay, periaqueductal grey matter is reaching mu receptors. যে না যেমন পাচ্ছিস দে না, অর্ধেক লোক তো বোধহয় বসবেই না। বসবে কি? আমার তো মনে হয় না, যারা ফেল করেছে তারা বসবে। বসবে ভালো, এখন পড়, ফাইনাল পরীক্ষার জন্য পড়, ঠিক আছে। So what else does it produce? Sedation. Sedation means না ঘুম পাড়াবে, ঠিক আছে। So basically a higher level of loss of consciousness, higher level of sedation will cause loss of consciousness, ঠিক আছে। So there is site specific stimulation and depression of CNS, means some part of CNS will be depressed, other will be stimulated. Produce drowsiness, indifference to surrounding, no motor incoordination, higher dose leads to coma. Now sedation helps in reducing the sensation of pain, ঠিক আছে। The sensation of pain, suppose there is a myocardial infarction, okay, the patient becomes apprehensive that I am going to die. তখন কি হবে? The sympathetic system starts to be activated. So what do you mean by myocardial infarction? So there is these myocardial vessels which get blocked by a clot. So a part of the heart wall has no blood supply. So that is myocardial infarction. That is causing this dull visceral pain. Okay. So when there is pain, patient bhoy peye jabe. So the sympathetic pathway gets activated. So what happens when the sympathetic pathway gets activated? Aro heartbeat bariye debe. Okay. So the oxygen supply is low and the sympathetic pathway is activated. Heart rate increase korche, ঠিক আছে। So that produce a detrimental effect on the heart. Okay. So if there is sedation, first when there is control of pain, analgesic, so the patient feels well and there is sedation, okay, so that sympathetic overactivity starts to decrease. So it contributes to the control of pain. Respiratory center. So you are inspiring and expiring without your knowledge. রাত্রিবেলা ঘুমোচ্ছি তখনও ইন্সপিরেশন এক্সপিরেশন হচ্ছে, ঠিক আছে। So that is being maintained by the respiratory centers. So respiratory centers can detect O2, CO2 as well as pH of blood. Okay, there are chemoreceptors that detects the partial pressure of oxygen, carbon dioxide and the pH. So as per the requirement, they increase or decrease the rate of respiration. So, what happens? Opium depresses the respiratory center. Most death take place due to stoppage of respiration. In opium overdose, morphine overdose, the death take place due to stoppage of respiratory centers. ঠিক আছে? So, it's dose dependent. So, what happens? There is something known as tolerance. Tolerance মানে? From your knowledge of general pharmacology. So, tolerance is the increase in the dose of a drug to produce same pharmacological action. ঠিক আছে? আগে 1 গ্রামে দিলে যা হতো এখন 5 গ্রাম লাগছে। So, that is tolerance. So, in the addict, there is tolerance of opium. So, why does this addiction take place? So, basically there is certain center in your brain known as the reward center, ventral tegmental area, okay, in the brain. They release dopamine. Okay. So, why is this reward center there? It is to maintain the normal physiology of your body. Suppose you are hungry, okay, ভালো লাগছে না, কিছু ভালো লাগছে না, ঠিক আছে, you get a meal, you have full meal, your reward centers get activated. So, there is discharge of dopamine. So, you feel satisfied, না মানে ভাত খেয়ে বেশ মনটা ভালো হয়ে গেল. So, that is the reward center. So, in opium what happens, that reward centers get activated permanently. Sorry, permanently বলাটা ভুল হবে, gets activated. So, basically you are cheating the reward center. It is constantly due to effect of the opium, it is releasing dopamine. That is what cause the kicks. ঠিক আছে, নেশাখোরেরা ওর জন্যই নেশা করে. So, that is how the reward centers get activated and you get the kicks. So, what happens in these kicks are subjected to tolerance. Okay, the dose of the opium has to be increased. The key at certain point there may be respiratory depression and death. ঠিক আছে, death takes due to respiratory depression, the decrease in rate and depth of respiration. Cough center. So, cough center is also a useful reflex. So, what happens if you put your finger in your mouth, immediately there will be cough. Any foreign body trying to get into the tracheal system, so the respiratory system, immediately cough. ঠিক আছে? So, it is a protective action. Now, suppose there is some irritant, some smoke or excessive secretion of mucus in your lungs or the trachea. So, that will cause irritation and coughing. তাহলে how the opioids will be helpful? In which case opioids will be helpful? In case of cough syrups. ঠিক আছে? These cough syrups mostly contains opioids, the lower opioids, is codeine. Okay. So, they basically suppress the cough centers. And where else do you require the suppression of cough centers? During intubation. গেছিস ওটিতে গেছিস? So, during OT you have to put this endotracheal tube. So, if you try to put it, I try to put it in you, immediately there will be cough reflex. So, that cough reflex has to be abolished during anesthesia, okay, to intubate the patient. In that case, as an anesthetic, pre-anesthetic medication or anesthetic medication, the opioids become useful. So these are the cuff centers. So the afferent pathway comes to the vagus nerve. Any irritation in the tracheobronchial tree comes to the vagus nerve. This is the medulla, okay, where the cuff centers are located. They get stimulated and the efferent comes to the phrenic nerve and the vagus nerve. Okay. So that causes the cough. So the same thing. Mood. So it produces kicks. So this is a picture of the brain. So here you can see the ventral tegmental area. Okay. Which other area releases dopamine? Substantia nigra. ठीक है जी? हाँ, nucleus accumbens substantia nigra. So it releases the dopamine that produces the kick. See, there are also fibers into the frontal cortex, fibers into the hippocampus. Frontal cortex related to the behavior. There is always drug seeking behavior. The hippocampus, the limbic system, there will be attachment to the drugs. Okay. So produces euphoria, that is the kick. বিশাল আনন্দ, কোনো কারণ ছাড়াই আনন্দ। Then calming effect. So sedation একটা হচ্ছে, ঠিক আছে? Loss of apprehension. Loss of apprehension, কালকে পরীক্ষা স্যার একটু কিছু দিন, টেনশন হচ্ছে, ঠিক আছে? So that apprehension get dissolved. ঠিক আছে? Detachment from surrounding. আশেপাশে কি হচ্ছে কিছু জানার দরকার নেই। Then lack of initiative, mental crowding, inability to concentrate. So the addict remain in their own dream world. Stimulation. So certain part of the brain are stimulated, certain part of the brain are depressed. Stimulation, CTZ, chemoreceptor trigger zone. কি করে? কি করে? হ্যাঁ, কি করে? ফাংশন? সো ভমিটিং সেন্টার, ঠিক আছে? তাহলে অ্যাক্টিভেট কেমোরিসেপ্টর ট্রিগার জোন, তাহলে কি হবে? ভমিটিং হবে, ওয়ান অফ দ্য অ্যাডভার্স এফেক্ট অফ ওপিয়েড, ঠিক আছে? দেন এডভিঞ্জার ওয়েস্টফাল নিউক্লিয়াস কি আছে? সেন্টার ফর থার্ড নার্ভ, ঠিক আছে? তাহলে কি হবে? থার্ড নার্ভ কন্ট্রোলস দ্য পিপল। সো থার্ড নার্ভ গেট অ্যাক্টিভেটেড, তাহলে কি হবে? মায়োসিস হবে, ঠিক আছে? পিন পয়েন্ট পিপল, বোঝা গেল? দেন মায়োসিস হবে, ঠিক আছে? মায়োসিস হবে। vagal center, vagus center. So the basically vagal center, vagus nerve supplies a large part of the GI tract, ঠিক আছে? তাহলে কি হবে? কনস্টিপেশন হবে। vagus nerve stops the propulsion of food in the GI tract, ঠিক আছে? Parasympathetic stimulation. So longer the food stay in your GI tract, more will be the fluid reabsorbed, so there will be constipation. Cortical and hippocampal area. So these are cortex and hippocampal area, ঠিক আছে? Hippocampus limbic system. So active presence of opioid receptor in mast cell. Mast cell contains mast cell contains histamine. Histamine. So there are two paths of release. One is by immunological activation. Hypersensitivity পড়ানো হয়েছে? হ্যাঁ, তো জানিস তো ইমিউনি অ্যালার্জিকের যে রিঅ্যাকশন হয়, অ্যালার্জিক রিঅ্যাকশন হয় তো, দ্যাট ইজ মিডিয়েটেড বাই, হ্যাঁ, হিস্টামিন তো ফাইনালি রিলিজ হবে, ঠিক আছে, ডিগ্রানুলেশন হয়ে হিস্টামিন তো ফাইনালি রিলিজ হবে, দ্যাট ইজ মিডিয়েটেড বাই দি immunological system. And there are some other receptor like the opioid receptor that also releases histamine. ঠিক আছে, this is not immunologically mediated. This is known as anaphylactoid reaction, not anaphylaxis. Anaphylaxis is mediated by the immune system. তাহলে হিস্টামিন কি করবে? bronchoconstriction, ঠিক আছে, আর কি করবে? ভেসেল vasodilation. তাহলে বিপি কি হবে? বিপি will fall, ঠিক আছে। টেম্পারেচার, so depresses temperature regulation, so what will it lead to? Hypothermia, ঠিক আছে। so বিপি তে কি হবে? histamine release, depression of vasomotor center, direct action decreasing the tone of blood vessel. The net effect কি হলো? decreases the BP. GIT কি করবে? রেডনেস তো হবেই, হ্যাঁ, মানে the level of histamine release will not be as great as that of you find in the immune mediated reaction. The anaphylaxis শকে যতটা হিস্টামিন রিলিজ হয় অতখানি হবে না, ঠিক আছে, কিন্তু হবে, রেডনেস হবে, ঠিক আছে। তাহলে কার কাছে, কোন পেশেন্টের কাছে খুব সাবধানে দিতে হবে? অ্যাসথমেটিক পেশেন্ট, COPD পেশেন্ট, ঠিক আছে, you have to use it carefully. GIT, increase GI tone, decrease propulsion, so the food stays longer in your GIT. The more the food stays in your GIT, more the fluid will be absorbed, ঠিক আছে। so as more fluid is absorbed, so the stool becomes hard, so there will be constipation, ঠিক আছে। so spasm of pyloric, ileocecal and anal sphincter, all sphincters get tightened, then decrease intestinal secretion, সবকটা মিলে কি করছে? end result constipation. Smooth muscle, spasm of sphincter of Oddi, sphincter of Oddi located in bile duct, হ্যাঁ, ঠিক আছে। তাহলে what will happen if a patient having gallstone is given opioid? আরো sphincter of Oddi আরো চেপে ধরবে, ঠিক আছে, অবস্থা আরো খারাপ হবে। তাহলে you should not give opioid to patient with gallstone. gallstone-এও প্রচুর পেন হয়, ঠিক আছে, এবং সেটা visceral pain. Tone of both detrusor and sphincter is increased. Detrusor muscle present in ureter, ঠিক আছে। so detrusor is being contracted, তাহলে কি হবে? ইউরিন পাবে, কিন্তু sphincter is being constricted, ইউরিন করতে পারবে না, ঠিক আছে। detrusor contraction হচ্ছে, so you find sensation of urine, but patient cannot do না, will have difficulty in voiding, ঠিক আছে। তাহলে কোন পেশেন্টের ক্ষেত্রে এগুলো কেয়ারফুলি ব্যবহার করতে হবে? you have to be careful in case of older males, ঠিক আছে, where there is hypertrophy of prostate. ঠিক আছে? Then bronchoconstriction. তাহলে earlier we have also seen release of histamine causes bronchoconstriction. So you must be careful in case of asthmatic, the COPD patient. Okay. Acha, neuroendocrine system. So there is decrease of FSH, LH, ACTH. So FSH, LH is important for ovulation. ঠিক আছে? Spermatogenesis. So FSH, LH is required. তাহলে না হলে কি হবে? ইনফার্টিলিটি। ঠিক আছে? হ্যাঁ 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 ওকে। প্রোল্যাক্টিন অ্যান্ড গ্রোথ হরমোন ইজ ইনক্রিজ। সো পিকচারটা খুব একটা ভালো আসেনি। ঠিক আছে? সো mu receptor causes analgesia. The strongest of them is caused by mu receptor, both supraspinal and spinal. Respiratory depression, ঠিক আছে? Sedation, euphoria, meiosis due to Edwinger Westphal nucleus কে অ্যাক্টিভেট করছে, meiosis করে দিচ্ছে। Bradycardia, ঠিক আছে? Hypothermia, physical dependence. Then Kappa 1, spinal analgesia. This was supraspinal and spinal. For Kappa it is mostly spinal analgesia. ঠিক আছে? Dysphoria. What do you mean by dysphoria? The opposite of euphoria. Euphoria দারুণ লাগছে, dysphoria খুব খারাপ লাগছে। ঠিক আছে? Sedation, psychomimetic. Psychomimetic জানিস? এ তো হয়ে গেছে, এসএসআরআইটা হয়ে গেছে তো, হয়েছে না? তাহলে ছেড়ে দে। আচ্ছা, ডেল্টা স্পাইনাল অ্যানেস্থেসিয়া। ওকে, chiefly operate by in the spinal level. So respiratory depression is not that severe like that of mu. Okay, these are weak. Kappa, delta, these are weak analgesic effect. The most prominent of them is mu, but mu also can produce respiratory depression তো আছেই, can produce euphoria. ঠিক আছে? So pharmacokinetics, high fast pass metabolism. তাহলে ওরালে দিয়ে খুব একটা কাজ আসবে না, তাই তো? What do you mean by fast pass metabolism? বল। এই ফাস্ট পাস মেটাবলিজম কিন্তু এতে আসে, শর্ট নোটে আসে। ঠিক আছে? ডিস্ট্রিবিউশন ইজ ওয়াইড, only small part enters brain. আচ্ছা, what is the reason that the medicine does not enter the brain? Blood brain barrier. ঠিক আছে? কাদের কাছে blood brain barrier is ill developed? Babies. Okay, produces active metabolite morphine 6 glucuronide. So which glucuronidation কিসে হয়? বায়োট্রান্সফরমেশন পড়েছিস? বায়োট্রান্সফরমেশন কিন্তু ইম্পর্টেন্ট, বায়োট্রান্সফরমেশন থেকে কোশ্চেন আসে। ঠিক আছে? দেন crosses placenta. So what is the significance of crossing placenta? So you must be careful in giving to pregnant women. ঠিক আছে? লেবারের সময় প্রচুর পেইন হয়, কিন্তু সেখানে ওপিয়াম ইজ নট ফেভার্ড। কেন? প্রথম কথা, প্রসেস প্লাসেন্টা, ঠিক আছে, বেবির ব্লাড ব্রেন ব্যারিয়ার ইজ পুয়ারলি ডেভেলপ। না, ওসব কিছু না, বেবির blood brain barrier is poorly developed. What happens when the baby is born? It cries. The first thing it does is cries. Due to crying, its lungs get inflated and respiration starts. Now, morphine has a property of depressing the respiratory center. Okay, so the baby will be lethargic. ঠিক আছে, cry করবে না। So, you must be careful in giving morphine in pregnant, in ladies in labor, ঠিক আছে। টলারেন্স, তাহলে টলারেন্স যে জিনিসটা 1 গ্রামে হতো সেই জিনিসটার জন্য 10 গ্রাম দিতে হচ্ছে। সো কোয়েশ্চেন কামস, which action does not produce tolerance? GI system, that is the constipating action, that does not show tolerance, and meiosis, that does not show tolerance. So withdrawal, তাহলে যা যা করছিল তার উল্টো টুল্টো হতে শুরু করবে, তাহলে it was decreasing secretion, তাহলে কি হবে? ল্যাক্রিমেশন, সোয়েটিং, এক্সেস বেরোতে শুরু করলো, ঠিক আছে। ডায়রিয়া, ডিহাইড্রেশন, so it was stopping the GI movement, so there is now excess of GI movement. Okay, then yawning, anxiety, fear, restlessness, insomnia, যা যা করছিল তার উল্টোটা হয়ে গেল। গুজ ফ্লেশ, মিড্রিয়াসিস, কি ছিল? মায়োসিস ছিল, তো এবারে মিড্রিয়াসিস হয়ে গেছে। ট্রেমার, ওয়েট লস, প্যালপিটেশন, রাইজ ইন বিপি, তার ফল হচ্ছিল রাইজ হয়ে গেল, ঠিক আছে। কার্ডিওভাস্কুলার কোল্যাপস, so there is something known as withdrawal symptoms. When a person get addicted, he is physically dependent on the drug. The normal physiological function is completely controlled by that drug. When that drug is withdrawn, his physiology completely collapses, ঠিক আছে। So that is withdrawal. So medical legal importance, অনেক সময় নেশাখোরদের পুলিশ ধরে নিয়ে আসে, ঠিক আছে। So in that case you must provide them with drugs. যে 100 গ্রাম খাচ্ছে তাকে 50 গ্রাম অথবা 80 গ্রাম দিতে হলো, but you must provide with drugs. If not provided, they will simply collapse, ঠিক আছে, মরে যাবে, মানে ড্রাগ না নিয়ে কিন্তু তারা বাঁচতে পারবে না। So ADR, sedation, ঠিক আছে, mental clouting, lethargy. So chemoreceptor trigger zone is being activated, leading to vomiting, ঠিক আছে। GI propulsion is stopped, constipation, respiration, respiratory center stop, respiratory depression leading to death, ঠিক আছে। urinary retention, ঠিক আছে, sphincter is being tightened, detrusor is contracting, then fall in BP, then anaphylactoid reaction. Anaphylactoid reaction is due to release of histamine. So in pregnancy and labor pain, so that causes crosses placenta, blood brain barriers is ill developed in infant, ঠিক আছে, respiratory depression, apnea, and it also causes slowdown of ureterine center, so the labor progress slows down. আচ্ছা, morphine is contraindicated in head injury. আচ্ছা, what happens in head injury? There may be increase in intracranial tension, some blood vessel may rupture, leading to increase in intracranial tension. Your volume of head is fixed in a skull. So, what happens in head injury? There may be vomiting, there will be meiosis. Okay. So, by noting these symptoms, we can relate to the prognosis of the case, prognosis of the patient. So, what happens? Morphine leads to respiratory depression. Okay. So, there will be carbon dioxide retention that may cause increasing intracranial tension. Already there may be some blood vessel rupture, fluid accumulation and increase in intracranial tension. Morphine will only aggravate the intracranial tension and respiratory depression. ঠিক আছে? So, vomiting, meiosis, altered mental status, these are some prognostic symptoms. You assess the meiosis, you assess vomiting, you assess the altered mental status, and you know how much the patient is improving or how bad the situation is going. But morphine itself causes these symptoms. So, you cannot really judge whether the patient is improving or it is deteriorating. বুঝলি? ঠিক আছে। So, contraindication কোথায় কোথায়? Infant, ঠিক আছে, elderly, ঠিক আছে, COPD হয়েছে, prostate বেড়ে রয়েছে, respiratory insufficiency, bronchial asthma, ঠিক আছে, head injury, hypotensive, hypovolemic, in hypotensive and hypovolemic patient. কেন? Morphine itself causes hypotension. Undiagnosed acute abdominal pain. Why? In case there is GB stone, gallbladder stone, it may aggravate the pain. Okay. Elderly male, prostate. ঠিক আছে? Unstable personality. কি করবে? নেশা করবে। ঠিক আছে? Drug interaction. So, drug that causes depression of brain, you usually don't combine with morphine. ঠিক আছে? Tricyclic antidepressant, phenothiazine, MAO inhibitor, amphetamine, neostigmine. Okay. Morphine itself causes depression of brain, may aggravate the situation. পড়ানো হয়েছে? অ্যান্টিসাইকোটিক হয়েছে? হয়েছে না হয়নি? হ্যাঁ, একা এসছে বলে আমি ছিলাম না। আচ্ছা, তাহলে ইন্ডিকেশনস, অ্যানালজেসিক ফর ডাল, পুয়ারলি লোকালাইজ ভিসেরাল পেন। ঠিক আছে? কেটে গেছে তার জন্য মরফিন দেওয়ার কোনো যুক্তি নেই। ঠিক আছে? মায়োকার্ডিয়াল ইনফেকশন কেন হয়েছে? উই হ্যাভ ডিসকাস। দেন পেইন অফ মেটাস্ট্যাটিক টিউমার। So, patient is in terminal condition, there is tremendous pain. In that case, we give morphine to alleviate the pain, okay, to give relief to the patient. Surgical anesthesia, ঠিক আছে? In surgery there is pain, in intubation you may require to suppress the cough system, the cough reflex. For that it may be used. During surgery you need analgesic, পেট কাটছে কিংবা হাত কাটছে, যাই কাটুক, ঠিক আছে? In that case, for that case you need pain to suppress the pain. Cough syrup, codeine, ঠিক আছে? Suppress the cough reflexes. Diarrhea. Diarrhea is the first condition that people started to use opioids. ওকে, এখনো পেট খারাপ হলে শুক্তো খাওয়া হয়, তো শুক্তোতে কি থাকে? পোস্ত। সো ভেরি স্মল কোয়ান্টিটি অফ opioids. Usually loperamide ইউজ করা হয়, দ্যাট ইজ অলসো অ্যান opioid. ঠিক আছে, ডায়রিয়া, opium will cause constipation. So this is a symptomatic treatment, not the cause of diarrhea, but it produces symptomatic relief. ঠিক আছে, প্রি অ্যানাস্থেটিক মেডিকেশন, পোস্ট সার্জিক্যাল পেন, সার্জারির পরে ব্যথা হচ্ছে, you control it by opium. So acute left ventricular failure morphine is indicated. কেন? It causes dilatation of blood vessel. Okay, so what happens during acute left ventricular failure? The left ventricle fails to pump blood, so the blood pools in the lungs. So what morphine does? Morphine depresses the respiratory system and also causes dilatation of blood vessel. So blood moves from pulmonary system to the systemic system, so that gives relief to the pulmonary congestion. Okay, হয়েছে কার্ডিওভাস্কুলার ড্রাগ হয়েছে? হয়নি, হয়নি, ঠিক আছে। সো ইট রিডিউসেস দি প্রিলোড। প্রিলোড কি করে রিডিউস করছে? ভেনোডাইলেশন করছে, দ্য প্রিলোড রিডিউসেস, ঠিক আছে। ব্লাড শিফট ফ্রম পালমোনারি টু সিস্টেমিক সার্কুলেশন, ডিপ্রেস রেসপিরেটরি সেন্টার, cuts down sympathetic stimulus. So morphine is used in myocardial infarction as well as in left ventricular failure. আচ্ছা, কোডিন। কোডিন is a cough syrup, ঠিক আছে, has poor analgesic function but is effective in controlling the cough reflexes. So কোডিন, অনেক সময় কাফ সিরাপ দিয়ে দেখবি পাচার হয়, ঠিক আছে, নেশাখোররা নেশা করার জন্য পাচার করে। দেন mild analgesic used in combination with other analgesic, ঠিক আছে। Pethidine. Now, pethidine is a drug widely used for pain relief, ঠিক আছে, less potent but more efficacious. What do you mean by efficacy? Definition. What do you mean by potency and efficacy? Potency is the maximum effect that a drug can produce, ঠিক আছে, আর efficacy means how small amount of drug can produce that effect, ঠিক আছে। So more efficacious means lesser amount of pethidine will produce greater amount of analgesia, or less potency means the amount of analgesia produced by morphine is greater than that of pethidine, ঠিক আছে। rapid onset, short duration, sedation, euphoria, tolerance, dependence. Pethidine can produce all. Respiratory depression, not effective in cough suppression, poorly controls the cough, ঠিক আছে, less histamine release, so it's more safer in patient. Fentanyl, শুনেছিস? Fentanyl is the drug of abuse. পুরো ইউএস জ্বলছে ফেন্টানিলের এতে, ফেন্টানিলের স্মাগলিং এ, ঠিক আছে। So more potent analgesia. So fentanyl is a intraoperative analgesia. In OT you use fentanyl, ঠিক আছে। Rapid onset, short duration, little propensity to release histamine. Transdermal patch, transdermal patch পড়েছিস? Transdermal patch কিন্তু কোয়েশ্চেন আসে, ঠিক আছে। Fentanyl as transdermal patch for cancer patient, terminal stage of cancer, transdermal patch লাগিয়ে রেখে দেয়, 12 hours of time থাকে, produces analgesia. Transdermal patch কিন্তু কোয়েশ্চেন আসে, পড়বি। ঠিক আছে, ইটস আ ড্রাগ অফ অ্যাবিউজ। Methadone is a synthetic opioid, analgesic, respiratory depression, emetic, antitussive, antitussive মানে cough suppression, ঠিক আছে, constipating and biliary action, high oral bioavailability, এগুলো কিসে দেওয়া হচ্ছিল, আইএম কিংবা আইভি দেওয়া হচ্ছিল, ঠিক আছে, হাই ফসফরাস মেটাবলিজমের জন্য। বিকজ ইট ইজ হাই ওরাল bioavailability, it can be used orally. Half life is 24 hour. So what is the significance of half life being 24 hour? Less amount of dosing, সেটা তো হলো, ঠিক আছে, আর 24 আওয়ারে একবার দিলেই হয়ে যাবে। So what is methadone used for? Methadone is used for de-addiction, ঠিক আছে। সো উইথড্রলে বললাম যে কি কি অ্যাকশন হয় সেগুলো তো আমরা জানলাম, ঠিক আছে। সো when that withdrawal takes place, so you must give something to satisfy the receptors, that is methadone. Once you give methadone, methadone goes and blocks the receptor, ঠিক আছে, for 24 hour. Even if the person have some drug, মানে কোনো আইভি ড্রাগ নিচ্ছে, ফেন্টানিল নিচ্ছে, সো দ্য রিসেপ্টার গেটস ব্লকড, নতুন করে আর কোনো এক্সাইটমেন্ট হবে না, কোনো ইউফোরিয়া প্রডিউস করবে না, বাট ইট ডাজ নট প্রডিউসেস দ্য উইথড্রল সিমটমস, বিকজ ইট ক্যান অ্যাক্ট অ্যাজ অ্যান অ্যাগনিস্ট ইন দ্য রিসেপ্টার, ইট ডাজ নট প্রডিউস এনি উইথড্রল সিমটমস, বুঝলি। সো মেথাডন ইজ ইউজড ফর থেরাপি, ফর substitution therapy for opioid dependence. Tramadol is central acting analgesic, low affinity for mu receptor, it produces analgesic but not via the mu receptor, ঠিক আছে, inhibit reuptake of noradrenaline and 5-HT serotonin, half life 5 hour, dizziness, nausea, dry mouth, drowsiness, short lasting, mild to moderate pain, ঠিক আছে, ওরালও দেওয়া হয়, আইএম আইভিও দেওয়া হয়। So that's all.